Okay, up next, we have Dr. Leslie Koenig, visionary owner and founder of Waybridge Ketamine Clinics. Dr. Koenig is a board-certified emergency physician and Afghanistan combat veteran. Serving 8 years in the Navy, she's translated skills obtained on the battlefield and front lines to write the Stress Relief Survival Guide, and operates a revolutionary clinic for the rapid treatment of depression, PTSD, OCD, and chronic pain. Leading from the front, she is also completing a fellowship from the University of Arizona's Integrative Medicine to better serve her patients with a whole health approach. Welcome, Dr. Koenig, to the stage. Paging Dr. Koenig, paging Dr. Koenig.
Hi. Thank you so much. All right, thank you so much. All right, so yes, I am Dr. Leslie Koenig, and I'm here to talk to you about ketamine. Has anyone here heard of ketamine and why I might be bringing up this anesthesia medicine in the context now of mental health? I see maybe one nod. Okay, great. So I'm talking to a crowd where I can do some education, which I always love to do. So I am Dr. Leslie Koenig, and ketamine is the next evolution of mental health. We are currently in a mental health crisis. In the last year, over 50,000 Americans committed suicide, which was a record-shattering number in the United States. And this is in the setting of having all the new medicines out there, all the pharmaceutical companies trying their best to create the next big thing on helping with depression, with anxiety, with PTSD, yet we are still suffering this mental health care crisis. That is with therapists working overtime, physicians working until burnout, and yet we still have this issue today. We also have 22 veterans committing suicide every day. And this is a situation where it may actually be underrepresented. It may be something like 44 suicides a day of American patriots committing suicide because of the mental care issues that are lacking today. Now, this is near and dear to my heart because I myself am a combat veteran. I spent 8 years in the Navy with a combat tour to Afghanistan in 2013. I saw firsthand how this affects our veterans, our active duty, and then coming home, just all of the after effects. So this is me at 29 Palms doing intubations. Again, I'm an emergency medicine physician, which is where I first encountered ketamine as a medicine. And in the ER, we use it as sedation, and that's what we knew for the longest time, was that it works for anesthesia, for sedation. It's a quick on, quick off, wonderful medicine that is actually on the WHO list of essential medicines because it is so wonderful, which I'll get into later. And then on the right here is when I was the emergency medical director of the ambulances at Camp Leatherneck. So ketamine is an old medicine with a new purpose. And what do I mean by that? So as I mentioned, it was FDA approved in 1970 for general anesthesia. And that's where it's just been around the world. The reason for that is in third world countries, you can then use it and not have to monitor. You don't have to worry about things like opiates, where if you give someone an opiate for pain control, their oxygen will drop because they start to not breathe so much, their heart rate can drop, yet ketamine doesn't do that. Now, this was under our nose all along. It's an old medicine with a new purpose because now we're finding it has these very rapid antidepressant effects. So it started as a dissociative anesthetic, and now what we're finding is with the antidepressant, it created an entirely new class of antidepressants called the rapid-acting antidepressant. All the other medications out there take something like weeks to take effect, if not maybe a couple months. And with that, you get increased suicidality as a side effect. When you read that note, from the pharmaceutical company, ketamine actually has the opposite. It works within hours, if not days, and within 2 weeks we'll know definitively how does it work, how does it respond with you. So I know there's a lot of questions I get quite a bit. What about, isn't it a horse tranquilizer? That's a big one I get. How can this medicine that I've heard about be used in that way? Well, I'm glad you asked, and I'll get to in a second. And what about some of these overdoses that I've heard of? For example, Matthew Perry. Is this really as safe as we think it is? And then lastly, a question I get a lot of is, well, I've heard of this, but don't people abuse that on the streets? There's like a recreational use for it. Why are we using it in this context for mental health? So to address all of these concerns, the thing about ketamine, as I mentioned, it's this outstanding safety profile. You can give it and not worry about monitoring your patient as intensely. For example, in the military, when I gave it to my patients during a mass casualty, I could give it to someone who needs it. They just got blown up by an IED, give them ketamine, and I had no problem with loading that patient up into a helicopter, into a very highly kinetic environment where the medic has little ability to monitor that patient, but we were able to give it and not worry about, again, some of these like opiate-type side effects or benzos or other things like that. So it's a very safe medication, which is why we will use it in the veterinary medicine space as well. Now, what about Matthew Perry? Well, we do it in a very safe setting. We use a very awesome monitoring setting, which I'll show you in a minute, and it is run by a physician. We have a doctor there or a nurse practitioner there at all times to monitor for any side effects, to monitor for any anxiety and whatever else people need. And then the other thing about recreational use is that tends to be not physiologic, but psychological. People just tend to like it. And that is mostly where that recreational use comes from. And the fact is, ketamine is actually found to actually help treat addiction. Many of my patients, for example, alcoholics, or even people who vape, use nicotine, they'll find after getting ketamine that their cravings drop. And in fact, some of the detox centers around here use ketamine a couple times during their detox to help decrease the cravings moving forward. So there's wonderful literature out there in the science about how it actually can help with addiction. So who is a good fit for a ketamine patient? Well, the top three, I would say, are number one, depression. This is where ketamine really, really shines. And this is where a lot of the data first came about with depression. A lot of the science is based on treatment-resistant depression. That means that people have tried 2 different antidepressants and gave them their full due course. Usually that's about a 6-week course, and didn't have improvements. Now, ketamine does work so well that in some cases we are seeing if we can maybe move it forward so that it's not one of those third-line therapies where you try one medicine, doesn't work, add a second medicine, doesn't work, and then ketamine. I mean, I'll be honest with you, a lot of my patients are at the end of their rope. They've tried everything, and they're on a list of medicines that the more you add, the more side effects you get, the more other medicines get added to mitigate those side effects, and they end up numb, gaining weight, losing their libido, and just feel like, I feel numb, Dr. Koenig. I can't do this anymore. I'm at the end of my rope. I'm really, really hoping ketamine can help, and yet I'm afraid to have hope because the system has failed them. As much as we've tried, as much as doctors have really just worked with patients, worked with the tools that we have, we're failing again. And I'm so amazed, I'm so happy to be part of science and medicine at this time where ketamine is coming to light, where everything that we've been doing has been psychology, psychiatry 2.0, and ketamine is moving us into the future, into the next frontier of how we address mental health. Anxiety is the second indication for ketamine therapy. With anxiety, it can be very debilitating. A lot of my patients feel like they're stuck in a prison. They want to go out and do things, but they just can't. The anxiety keeps them at home. They want to say yes to life, and yet they have to say no because their anxiety just pulls them back in, and they say, what if? What if? And then they spin in circles, and then they just start to cycle. They don't see their friends. They don't go to family gatherings. They don't go to the grocery store. They want to, but they're in prison. How do you break out despite everything that you've tried? Ketamine is one of those solutions. And then lastly, PTSD is another indication. I put up a picture of a veteran, and yet this is for all PTSD. It doesn't matter military, non-military. A lot of my PTSD patients, when they start to notice improvements, will say that they notice the improvement between when they get triggered, they actually are able to see the trigger and then respond, instead of go to their immediate knee-jerk reaction of whatever their old habits were. You have the ability to lay down new neuronal networks so that you can create a different action, a different outcome, and a different result. Pain is another indication. Chronic pain, migraines, fibromyalgia, back pain, I see a number of those. And if you have any questions, we also do free screenings. So what does it look like when you actually come in for a ketamine treatment? Well, the setting itself is described as safe and spa-like. We're located right next to Lakeside Hospital, and we do have me as an emergency medicine doctor supervising the treatments. The setting themselves, we have zero-G recliners, and we've been very intentional about making it a wonderful environment for patients to have a experience to sit back and have that non-ordinary state of consciousness. A lot of mental work can be done in that space. And we also do noise-canceling headphones. We do soft lighting. Again, very intentional about every aspect from start to finish. The monitored setting includes a little blood pressure cuff the size of a Band-Aid. It actually sits on your finger. I love showing it off because it's so high-tech. We continually monitor blood pressure, heart rate, breathing, and oxygen. And then we take a very integrative approach. So I am actually currently a fellow in a integrative fellowship program through the University of Arizona. And so we'll integrate the sense of smell into the session with essential oils, because there's actually a whole nother reason for that. Not just aromatherapy, but it helps indicate when the ketamine is starting to take effect. So people wonder what's happening. Is the ketamine really starting? Yes, the essential oil kind of help be a guide in that way. And then we also offer tea, journaling, and meditation. So how is ketamine different? Many people are used to, I go to the doctor, I'm depressed, I'm anxious, I see my therapist, what do? We talk, I get a pill, see what happens. So ketamine is different in that it is unlike any other medicine out there. It is an NMDA receptor antagonist, which means that it doesn't work on the serotonin or norepinephrine pathway the way that everything else does. It doesn't just bathe your brain in medicine daily. This is not like that. This is only 6 sessions, 3 weeks, and hopefully I never see you again. Not that that's bad, but it's because of what you see on the screen here. So this is a rodent neuronal, a rodent neuron. The first one is a normal rat, where you can see that there are these little dendritic spindles growing. That's a normal one. That is indicative of like connections being made. Imagine telephone wires talking to each other, telephone wires. They then take the rats and stress them. That's the middle one, chronic stress. Those connections are dropped. It's as if there's no communication happening, things get sluggish, and you just can't think your way out of depression. It doesn't work that way because this is what it looks like. Now, ketamine, if you give a dose 24 hours later, it looks normal again. You're actually starting to get those neuronal connections started, this dendritic spindleization happening, and that's because of brain-derived neurotrophic factor leading into neuroplasticity. So it's like a fertilizer where you can actually kickstart growth. We're not just bathing you in chemicals and get used to the chemicals. We're actually changing the brain structure itself. And we're reawakening parts of the brain that were previously depressed. And this is in the case of just 1 session. We do 6 sessions so that we can build and build and build. Stack growth, and get you with back to your life. Get your goals met. So a lot of people ask, oh, this sounds great. How do I get started? Well, short answer is talk to your doctor first. I want to make sure that when I'm providing this therapy, that your therapist is on board and your doctor's on board. If you have anybody in your ear saying, no, this is a bad idea, we want to address that and answer questions. Usually it's an education question or an education issue where they've heard of it, but they're afraid. I'm happy to talk to your doctor, talk to your therapist, address any fears, and give some of the data that I'm about to show you. Second thing is that you can always visit our webpage, and again, we do free screenings, and then we schedule and prep, which I'll go into that. So if you're interested in a little freebie that we give our patients, you can take your phone out, because here's a free QR code for the meditation course that I designed. I'm not a therapist. I tell my patients that I'm an ER doctor, but I am a meditation coach. And so you can go to this drive, get our meditation course, and this will prepare people for their ketamine sessions, because in ketamine, it's the mind seeing the mind. You're sitting there with your thoughts, and this is how you can prepare that muscle to look at those and see how this environment really is inside your brain. Because that's where you are all the time. You're with yourself for your entire life. So you may as well get used to seeing what's in there and understanding it better. And meditation is a great way to do that. And meditation and ketamine, trust me, I've talked to many other people in this space, practitioners. Meditation and ketamine go very well hand in hand. You can also listen to my cat somewhere in there. I think it's like the third one. So Van D mentioned his dog Baxter, but my cat McDundee was kind of pawing at the door. So let me know if you hear that. So you get rapid results. Within 3 weeks, people are completely changed. People who walk into our clinic are not the people who walk out. They walk in, minimal eye contact, slowed words, kind of in on themselves, and they're saying, I'm out of hope. I don't know what to do. We have tissues in there for a reason. Families are afraid. I've heard good things about ketamine. I've seen it on the internet. I read up, but I'm worried. What if it doesn't work? I'm afraid to get my hopes up. And that's why I let them know this is how fast we'll know. It's not just another pill for many reasons, but this is what it looks like in real time. So what we'll do is we'll start with an H&P, come talk, and we'll go through each patient's exact goals. Why are you here? What is it about ketamine that drew you to make the call? And so that way we know that we are directing our care for each individual person with precision. And so they say you come in on a Monday. We'll talk, we'll do an infusion. And what you see here are graphs of patients giving their depression scores or PHQ-9s. I have many patients who respond positively to, in the last 2 weeks, have you felt worthless? How many days have you felt worthless? Every day. In the last 2 weeks, how often have you thought about killing yourself? Every day. Many of my patients walk in responding yes to those questions. Every single day, they're thinking of killing themselves. Every single day, they have to fight that urge, feeling worthless, down, can't get out of bed, can't take a shower. And this is a real patient. These are real results where come in on a Monday, get infused. Thursday, come in, second infusion. The next week, twice. The next week, twice. Every session, dropping, getting their life back. And these results last. This isn't just something where I infuse you, you feel better, 4 hours later, you're back to your old self with the depressed side, the one responding yes to all these questions. This patient continued answering these questions for 2 months, and I haven't seen this patient since. And this is what I mean. I, as an ER doctor, I love seeing quick, rapid, lasting results and actually having that immediate gratification of I made you feel better. I am living up to my oath of healing people. And that's what I get to do every day with ketamine. So bottom line with ketamine, I am a veteran. I know that a lot of veterans don't want to seek help. I was, as a physician and in the military, I've been in a very male-dominated field with the I don't want to get help, I'm fine, I'll think about all this stuff later, a lot of the denial. But just so you know, I understand, I have seen it, and it's a safe place. You were meant for more than what your depression has taken from you. And that's where we can come at it from a professional, evidence-based, science-driven, and patient-oriented, precise approach so that we are giving you your life back. We're getting you out of that prison in a way that you can see us and then literally send us a postcard from the travels that you are now capable of doing. I love getting thank you cards from my patients. I'm running out of space, to be honest, because of the honestly miraculous changes that ketamine can do. I never would have thought it until I saw it for myself. I didn't believe it, but I'm here to tell you that this is for real. It's what's to come. It's what's next. It's the next evolution of mental health. As I said, rapid results, decreased suicidality within hours. It lasts. Patients sometimes come in for boosters once a year, if that. Most often the goal is that we get you feeling better, get those new neuronal networks, that neuroplasticity lasting, so that you can live your life, get off all your meds, get back to being you, see your family, go on vacations. And patients seem to like us. So this is a patient who is a Marine Corps veteran, and he was the one who said it's like water off a duck's back. It's just amazing the results that we see. And I just want to be able to share this with the world. Right now, it's an issue of mental stigma against mental health. You know, you've tried everything. You come to wellness events. You research, you study, you try the pills that doctors give you. You talk to your therapist and hitting that wall. And the fact is, sometimes We just need to solve it from a neuroplastic scientific level to get you through those walls, to reclaim the neuronal networks, and that translates really into reclaiming your life. Thank you.
All right, thank you, Dr. Koenig.
Hey, thank you.